Margaret Thompson was reaching for her favorite teacup on the kitchen counter when the world suddenly tilted sideways, sending her crashing to the floor with a sickening thud that echoed through her empty house. And what she didn't know in that terrifying moment was that the very medication she'd been faithfully taking to protect her heart was actually putting her life in danger with every single dose. You see, Margaret had been taking the same blood pressure medication for over 8 years, trusting her doctor completely, never questioning why she'd been feeling increasingly dizzy and unsteady on her feet, especially when she stood up from her favorite armchair or got out of bed in the morning, and like millions of seniors across America, she had no idea that certain blood pressure medications are silently wreaking havoc on the body's natural ability to maintain balance and stability. The fall that changed everything happened on a Tuesday morning in March, just like any other day, except this time when Margaret hit the hardwood floor of her kitchen, she couldn't get back up, and as she lay there waiting for her neighbor to find her 3 hours later, she began to wonder if this was somehow connected to the strange lightheadedness she'd been experiencing for months, that peculiar sensation of the room spinning whenever she moved too quickly, the way her legs seemed to turn to jelly when she stood up from sitting, and the increasing number of times she'd grabbed onto furniture or walls to steady herself, dismissing these warning signs as simply getting older, when in reality her body was desperately trying to tell her that something was dangerously wrong. What Margaret discovered during her hospital stay would shock you to your core, because the emergency room doctor, a young resident who'd recently completed specialized training in geriatric medicine, took one look at her medication list and immediately knew what had caused her devastating fall, pointing to the little white pill she'd been taking religiously every morning with her coffee, explaining that this particular class of blood pressure medications, known as alpha blockers, can cause what medical professionals call orthostatic hypotension, a fancy term for blood pressure that drops so dramatically when you change positions that your brain literally doesn't get enough oxygen to function properly, leaving you dizzy, disoriented, and at extreme risk for life-threatening falls. But here's what's truly terrifying about this situation, and why every single person watching this video needs to pay close attention right now. Margaret's doctor had never once mentioned this potentially deadly side effect, never warned her about the increased fall risk, never explained that her medication was essentially turning her into a walking time bomb every time she stood up. And this isn't an isolated incident or a rare occurrence because according to recent research that most doctors aren't even discussing with their patients, certain blood pressure medications are responsible for thousands upon thousands of serious falls among seniors every single year. Falls that result in broken hips, traumatic brain injuries, and yes, even death. You might be sitting there thinking, well, my blood pressure medication is different, this couldn't possibly apply to me, but I need you to understand something that could literally save your life or the life of someone you love. There are several categories of blood pressure medications that carry this hidden danger, and the chances are frighteningly high that you or someone in your family is taking one of them right now at this very moment without having any clue about the risks involved. The alpha blockers I mentioned with names like doxazosin, prazosin, and terazosin are just the tip of the iceberg because there's another entire class of medications called ACE inhibitors that can cause similar problems, along with calcium channel blockers and even some diuretics, all of which can interfere with your body's natural ability to regulate blood pressure when you change positions, creating a perfect storm for dangerous falls that can happen without any warning whatsoever. The medical community has known about this connection for years, yet somehow this critical information isn't making its way to the patients who need it most, leaving millions of seniors unknowingly at risk every single day, every time they stand up from a chair, get out of bed, or simply bend over to pick something up from the floor. Let me tell you about Robert, a 68-year-old retired teacher who'd been taking lisinopril for his high blood pressure, living independently in the same house he'd called home for 40 years, until one evening when he stood up from his recliner to answer the phone and found himself flat on his back, staring up at the ceiling fan he'd installed himself 20 years earlier, completely unable to remember how he'd ended up on the floor. Robert's fall wasn't as dramatic as Margaret's. There was no loud crash or obvious injury, but what happened next reveals another disturbing aspect of this hidden epidemic that's affecting seniors everywhere. He started to notice a pattern, a terrifying sequence of events that began to unfold with increasing frequency, where standing up too quickly would cause the world to spin and his knees to buckle, where getting out of his car after a long drive would leave him gripping the door handle for support, where even something as simple as reaching up to get a book from a high shelf would trigger waves of dizziness that made him question whether he was losing his mind or developing some mysterious neurological condition. The truth is, Robert's brain was being systematically starved of oxygen every time his blood pressure medication caused his cardiovascular system to overreact to position changes, creating a cascade of physiological responses that his aging body simply couldn't compensate for quickly enough. And this is happening to countless seniors who are suffering in silence, attributing their symptoms to normal aging when they should be questioning whether their medications are actually causing more harm than good. Now, before you panic and throw all your medications in the trash, which would be incredibly dangerous and potentially fatal, you need to understand that blood pressure control is absolutely crucial for preventing heart attacks, strokes, and other cardiovascular disasters. So the solution isn't to stop taking your medications, but rather to work with a knowledgeable healthcare provider who understands the delicate balance between managing your blood pressure and protecting you from fall-related injuries that could be just as deadly as the conditions these medications are designed to prevent. The problem is that many doctors, especially those who aren't specifically trained in geriatric medicine, don't fully appreciate how dramatically the aging process changes the way our bodies respond to medications, how the natural decline in reflexes, muscle strength, and sensory input that comes with getting older can turn a mild medication side effect into a life-threatening hazard that requires careful monitoring and potentially alternative treatment approaches. This is why Margaret's story becomes even more compelling when you learn what happened next, because after her fall and subsequent hospitalization, she was referred to a geriatrician who specialized in medication management for older adults. And this doctor did something that no other healthcare provider had ever done. He actually listened to her concerns about dizziness, took her symptoms seriously, and most importantly, he measured her blood pressure both lying down and standing up, discovering a dramatic drop that clearly indicated her medication was causing dangerous orthostatic hypotension. What this specialized doctor found was truly eye-opening, because Margaret's lying down blood pressure was perfectly controlled at 120/70, exactly what you'd want to see in someone her age. But when she stood up, her systolic pressure plummeted by more than 30 points, dropping so low that her brain wasn't getting adequate blood flow, which explained not just her fall, but months of subtle symptoms she'd been experiencing and dismissing as unimportant. The doctor explained that this kind of dramatic blood pressure drop upon standing is like your cardiovascular system playing a dangerous game of catch-up every time you change positions, where your heart and blood vessels are frantically trying to adjust to gravity's effects, but the medication is interfering with the normal physiological responses that should keep your blood pressure stable and your brain properly oxygenated. This revelation led to a complete medication review, where the doctor discovered that Margaret was also taking a diuretic that was compounding the problem by reducing her blood volume, making it even harder for her cardiovascular system to maintain adequate pressure when she stood up, and this combination of medications, while individually appropriate for blood pressure control, was creating a perfect storm for falls that could have easily been prevented with better medication management and patient education. Here's what makes this situation even more infuriating for families dealing with these issues. The warning signs are often dismissed or misattributed to other causes, leaving seniors and their loved ones completely unprepared for the sudden, devastating falls that can change everything in an instant. You know that feeling when you stand up too quickly and feel a little lightheaded for a moment before everything clears up? That's a normal physiological response that happens to everyone occasionally, but when you're taking certain blood pressure medications, that momentary dizziness can become a prolonged, dangerous drop in blood pressure that leaves you vulnerable to falling for several minutes after changing positions. And the difference between normal, temporary lightheadedness and medication-induced orthostatic hypotension can literally be the difference between a minor moment of dizziness and a life-altering injury. The truly frightening part is that these falls often happen when seniors are alone in their own homes during routine activities that they've performed thousands of times without incident, which means there's often no one around to help when disaster strikes, no family member or friend to call for assistance, no immediate medical intervention to minimize the damage from traumatic injuries that could have been completely prevented with proper medication management and patient awareness. Think about your own daily routine for a moment and consider how many times throughout the day you change positions without even thinking about it, getting out of bed in the morning, standing up from the breakfast table, rising from your favorite chair to answer the door, getting up from a restaurant booth after dinner with friends, or simply standing up after kneeling down to work in the garden. Each of these seemingly innocent position changes becomes a potential hazard when you're taking medications that interfere with your body's ability to maintain stable blood pressure. And what's particularly cruel about this situation is that the people most at risk are often the most conscientious about taking their medications exactly as prescribed, never missing a dose, never questioning their doctor's recommendations, trusting completely in the medical system that's supposed to be protecting their health and well-being. These are the same people who've spent their entire lives being responsible, following rules, trusting authority figures, and taking care of their families. And now they're being betrayed by the very system they've trusted to keep them safe and healthy in their golden years. The research on this topic is both extensive and deeply troubling because multiple large-scale studies have definitively established the connection between certain blood pressure medications and increased fall risk in older adults, yet this information remains largely hidden from the patients who need it most, buried in medical journals that most people will never read, discussed in professional conferences that focus on clinical outcomes rather than patient safety and quality of life. One particularly striking study followed over 4,000 seniors for 5 years and found that those taking alpha blockers had a 40% higher risk of serious falls compared to those taking other types of blood pressure medications, while another study discovered that the combination of multiple blood pressure medications significantly amplified the fall risk, creating a multiplicative effect that puts patients in extreme danger without their knowledge or consent. What's even more disturbing is that when researchers interviewed the participants in these studies, they found that fewer than 20% had ever been warned by their doctors about the potential for increased fall risk, and virtually none had been taught simple strategies for minimizing their danger, like rising slowly from seated or lying positions, staying well hydrated, or recognizing the early warning signs of orthostatic hypotension. Let me share another story that illustrates just how preventable these tragedies really are, because knowledge truly is power when it comes to protecting yourself and your loved ones from unnecessary harm. Eleanor was a 71-year-old grandmother who'd been taking amlodipine, a calcium channel blocker, for her hypertension, and like so many others, she'd been experiencing subtle symptoms that she attributed to normal aging, occasional dizziness when standing up quickly, moments of feeling unsteady on her feet, and a general sense that her balance wasn't quite what it used to be. The difference in Eleanor's case was that her daughter Sarah, a nurse who worked in a cardiac rehabilitation unit, had recently attended a professional development seminar on medication safety in older adults, and when Eleanor mentioned her symptoms during a family dinner, Sarah immediately recognized the potential connection to her mother's blood pressure medication. Instead of dismissing these concerns or assuming they were just part of getting older, Sarah encouraged her mother to keep a detailed diary of her symptoms, noting the timing in relation to when she took her medication, what activities she was doing when the dizziness occurred, and how long the episodes lasted. And this simple documentation revealed a clear pattern that proved the medication was indeed causing dangerous drops in blood pressure. Armed with this information, Eleanor and Sarah approached Eleanor's doctor together, presenting the symptom diary and asking specific questions about orthostatic hypotension and alternative treatment options. And while the doctor initially seemed reluctant to change a medication regimen that was effectively controlling Eleanor's blood pressure, the documented evidence of medication-related symptoms was impossible to ignore. The solution in Eleanor's case involved switching to a different class of blood pressure medication with a lower risk of orthostatic side effects, combined with some lifestyle modifications like increasing her fluid intake, wearing compression stockings to help maintain blood volume in her lower extremities, and learning techniques for transitioning between positions more safely. The transformation was remarkable because within just a few weeks of making these changes, Eleanor's dizziness episodes virtually disappeared, her confidence returned, and she was able to resume activities she'd been avoiding due to fear of falling, proving that with the right knowledge and medical support, these medication-related fall risks can be effectively managed without sacrificing blood pressure control. What Eleanor's story teaches us is that you don't have to be a victim of circumstance when it comes to medication side effects, because you have more power and control over your health care than you might realize, but you need to be informed, proactive, and willing to advocate for yourself or your loved ones when something doesn't feel right. The medical system, for all its advances and capabilities, is not designed to catch every potential problem or side effect, especially when it comes to the complex interactions between multiple medications and the aging process, which means that patients and their families need to become active participants in their own health care, asking the right questions, reporting symptoms that might seem minor or unimportant, and demanding explanations when treatments aren't working as expected or are causing unexpected problems. This isn't about being difficult or demanding. It's about recognizing that your safety and well-being are too important to leave entirely in someone else's hands, no matter how qualified or well-intentioned they might be. The list of blood pressure medications that can cause orthostatic hypotension and increase fall risk is longer than most people realize, and it includes some of the most commonly prescribed drugs in this category, which means that millions of seniors are potentially at risk without knowing it. Alpha blockers like doxazosin, prazosin, and terazosin are among the highest risk medications, but ACE inhibitors such as lisinopril, enalapril, and captopril can also cause problematic blood pressure drops, especially when combined with diuretics like hydrochlorothiazide or furosemide that reduce blood volume and make it even harder for the cardiovascular system to maintain adequate pressure when standing. Calcium channel blockers, including amlodipine, nifedipine, and diltiazem, represent another category of concern, particularly for older adults who may already have age-related changes in their blood vessels and heart function that make them more susceptible to position-related blood pressure fluctuations. Even some of the newer blood pressure medications like ARBs, angiotensin receptor blockers, such as losartan and valsartan, can occasionally cause orthostatic hypotension, especially in patients who are taking multiple medications or have other health conditions that affect their cardiovascular system. But here's the crucial point that I need you to understand before we go any further. Having your name on this list doesn't automatically mean you're doomed to experience falls or that you need to stop taking your medication immediately, because the key is awareness, monitoring, and working with healthcare providers who understand the importance of balancing effective blood pressure control with fall prevention strategies. The tragedy isn't that these medications exist or that they sometimes cause side effects. The tragedy is that so many patients are taking them without any knowledge of the potential risks, without any guidance on how to minimize those risks, and without any systematic monitoring to detect problems before they result in serious injuries or worse. What we're talking about here is informed consent in its truest form, where patients understand not just the benefits of their medications, but also the potential risks and how to manage those risks effectively. And unfortunately, this level of comprehensive patient education is rare in today's rushed healthcare environment, where appointments are brief and doctors are under pressure to see as many patients as possible in the shortest amount of time. The physical mechanics of what happens during an orthostatic hypotension episode are both fascinating and terrifying when you really understand what your body is going through during these dangerous moments. When you're sitting or lying down, your blood pressure is relatively stable because gravity isn't working against your cardiovascular system. But the moment you stand up, gravity immediately begins pulling blood toward your lower extremities, reducing the amount of blood available to circulate to your brain and other vital organs. In a healthy cardiovascular system, your body responds to this challenge within seconds, automatically increasing heart rate, constricting blood vessels in your legs and abdomen, and making other adjustments to maintain adequate blood pressure and brain perfusion. But when you're taking certain blood pressure medications, these normal compensatory mechanisms are blunted or blocked entirely, leaving your brain temporarily starved of oxygen and nutrients. During those critical seconds or minutes when your blood pressure has dropped, but your body hasn't been able to compensate effectively, you're essentially walking around with insufficient blood flow to your brain, which explains why people describe feeling dizzy, lightheaded, confused, or like they might faint, and why their reflexes and balance are compromised to the point where a simple misstep can result in a catastrophic fall. The ripple effects of medication-induced falls extend far beyond the immediate physical injuries, creating a cascade of consequences that can permanently alter a senior's quality of life, independence, and overall health status. When someone like Margaret or Robert experiences a serious fall, the immediate concern is obviously broken bones, head injuries, and other acute trauma that requires emergency medical treatment. But what many people don't realize is that falls often trigger a downward spiral of declining health and independence that can be even more devastating than the original injury. After a fall, many seniors develop what healthcare professionals call fear of falling, a psychological condition where the anxiety about future falls becomes so overwhelming that it leads to severe activity restriction, social isolation, and rapid physical deconditioning that actually increases the risk of future falls, creating a vicious cycle that's incredibly difficult to break. The loss of confidence and independence that follows a serious fall can transform a previously active, engaged senior into someone who's afraid to leave their house, afraid to participate in activities they once enjoyed, and increasingly dependent on others for basic daily activities, which often leads to depression, anxiety, and a rapid decline in overall physical and mental health. Consider the broader implications for families dealing with these situations, because when a medication-induced fall results in serious injury, it doesn't just affect the person who fell. It impacts everyone who loves and cares for them, often forcing difficult decisions about living arrangements, care needs, and financial resources that no one was prepared to make. Adult children find themselves suddenly thrust into caregiving roles they never expected, struggling to balance their own work and family responsibilities with the need to ensure their parents' safety and well-being, while spouses often become full-time caregivers overnight, watching helplessly as their partner's health and independence deteriorate following an injury that could have been prevented with better medication management. The financial costs are staggering as well, because fall-related injuries in seniors result in billions of dollars in healthcare expenses every year, from emergency room visits and hospitalizations to rehabilitation services and long-term care needs. And much of this expense falls on families who are already struggling with the rising costs of healthcare and prescription medications for older adults. The most heartbreaking aspect of this entire situation is how completely preventable most of these medication-related falls actually are. Because with proper education, monitoring, and medication management, The vast majority of seniors taking blood pressure medications could continue their treatments safely while dramatically reducing their fall risk. The solution starts with comprehensive medication reviews conducted by healthcare providers who specialize in geriatric medicine and understand how aging affects the way our bodies process and respond to drugs, including systematic assessments of orthostatic blood pressure changes, fall risk factors, and the complex interactions between multiple medications that many seniors are taking for various health conditions. Simple interventions like adjusting medication dosages, changing the timing of when medications are taken, switching to alternative drugs with lower fall risk profiles, or adding complementary strategies like compression garments and hydration management can make an enormous difference in patient safety without compromising blood pressure control. Patient education is equally crucial because when seniors understand the connection between their medications and fall risk, they can take proactive steps to protect themselves, like rising slowly from seated or lying positions, ensuring adequate hydration throughout the day, wearing appropriate footwear with good traction and support, removing fall hazards from their living environment, and most importantly, recognizing the early warning signs of orthostatic hypotension so they can take immediate action to prevent a fall. This education needs to extend to family members as well, because adult children and spouses are often the first to notice changes in their loved one's balance, mobility, or cognitive function that might indicate medication-related problems, and they need to know when and how to advocate for better medical care and medication management.